Good morning. Welcome to the University of Houston College of Pharmacy interview. I am Liz Coyle, and I am the Associate Dean for Academic Affairs here at the College of Pharmacy. I've actually been at the College of Pharmacy for 25 years. I am a pharmacist, and I lecture in a variety of places throughout the curriculum. I used to have a practice site that students went with me over at MD Anderson Cancer Center within infectious diseases. I'm now part of the administration, and as the Associate Dean for Academic Affairs, I really have the oversight of the curriculum. So I'm going to take a few moments and kind of really go over what our curriculum is here at the College of Pharmacy. So kind of buckle up for a really quick overview of our program. One of the things that we feel is really important is that you feel like a pharmacist from the minute that you come into the program. So we start out really having that hands-on, where in our skills lab in that first year, you will be doing compounding, and you'll probably do some compounding in our state-of-the-art lab here within that first few weeks of the College of Pharmacy. You also might see, hey, we have some of those basic sciences in that first year of the curriculum. And really what we're trying to do is get everybody on the same page and really try to set that foundation that everybody will be utilizing throughout your career. So we have biochemistry, immunology, pathophysiology. Then you have your pharmaceutics. Pharmaceutics is kind of where you are learning what is a pill, what is a capsule, what is a patch, and how does that affect how drugs are delivered and or made. You also then will see calculations. Guys, calculations is one of the most important things that you have to know as a pharmacist. So brush up on that algebra, because that is what sets us apart, is the ability to do unique calculations as a pharmacist. We also then have in preparation for your introductory pharmacy practice experiences, you will see that we have a courses in patient assessment. So how do you, when somebody comes to you with a rash, how do you assess the rash? What kind of things do you do and to communicate with those patients? We have OTC and self-care, understanding what kind of pharmacological and non-pharmacological decision making do we have in helping them. You also actually learn some law through fundamentals of pharmacy practice, as well as learning about immunizations, where then you're going into the lab in that skills labs. So our skills labs are made to, you're not always in the classroom. You're going to take what you learn in the classroom and apply it in our skills labs. So in that skills lab too, you're learning about pharmacy practice, you're learning about community flow, you're learning about doing immunizations, you will be certified, learning how to take blood pressures, assess blood pressures, assess blood glucose levels, and applying that to patient care. You're going to get to practice this then between your first year and your second year in our first introductory pharmacy practice experience, which is in the community setting, where you will do a 4-week block, 40 hours a week for 4 weeks. There's 3 blocks throughout the summer, and you will be set in one of those blocks of A, B, and C to do that introductory pharmacy practice experience in the community. Don't worry, you say, I've been a technician for years, I know community. Well, guess what? You're going to be applying the laws, and you're going to be working as that pharmacist in applying what you learned in that first year of pharmacy school in that community setting. We also balance out, and you'll see in our summers, in order to do with financial aid. Mr. Parker will talk to you about that. But you have a 2-credit-hour course, 4280, which is called Patient Safety and Informatics. This is an online self-paced course throughout the summer that teaches you the important parts of informatics and patient safety. Before you know it, you're in your second and your third year, and I'm going to kind of combine those because our second and third year is where we start what we call our integrated curriculum. You have some traditional courses that run your full 15 weeks of a semester. In that first P2 semester, pharmacokinetics, remember math? Pharmacokinetics is that math, how a drug goes in, how is it eliminated, all those calculations. You also have literature evaluation. You have some management courses, introductory or leadership and interprofessional education. But then we go into those integrated modules, and you'll see within that first semester, there's 3 integrated modules: the renal, the GI, and the respiratory. And what these are is they're like mini courses throughout the semester. So you'll do 5 weeks of renal, then you go on to 5 weeks of GI, and then the last 5 weeks are respiratory. They're kind of standalone courses, but they build and integrate amongst each other. So an integrated disease state module will have pharmacology, will have medicinal chemistry, will apply some of that pharmacokinetics, pharmacotherapy, toxicology, over the counter medications, and pathophysiology, really integrating it in disease state management. And you can understand, and you learn the renal. Renal will apply when you go into GI. It'll apply when you go into respiratory, and they build throughout the curriculum. Well, one of the ways we solidify then that learning is what we call our module-related skills labs. And those are each semester in that second and third year. And that's when you go into the skills lab, you do patient cases, and you bring in everything you've learned to actually come up with an assessment and plans in managing disease states. We also have standalone Skills Lab 3 within that P2 fall, and that is where you're going to do sterile compounding. You're going to go into the IV room and learn how to do sterile compounding. You're also going to do Journal Club and learning how to apply literature evaluation and evidence-based medicine. In that second semester, you again have more of those integrated modules, and that's ones such as cardiovascular, men's and women's health, endocrine. And then you also have some management courses as well as the MRSLs to get you ready between that second and third year. Between your second and third year, you have another introductory pharmacy practice experience. You're going to pull in what you've learned the last 2 years. And this time you're going to be in an acute care setting, so a hospital, a long-term care facility, really seeing a different side of pharmacy practice. And that, again, is a 4-week block, either in A, B, or C in that hospital setting. And to balance that out, then this is your opportunity to do your first set of electives. And so you can do 1 to 2 electives during that summer. And we have geriatrics, pediatrics, advanced compounding, literature, more literature evaluation, evidence-based medicine, and ethics. So a lot of variety of things to do during that summer. Before you know it, you're in your third year. Your third year, we go into a little bit more complex of the introductory pharmacy practice experience, or I'm sorry, in your integrated modules. And your integrated modules such as infectious diseases, immunology, oncology, hematology, neurology, psychiatry. And so some of those bigger ones that are building in, before you know it, the end of that third year, you also have in that spring semester of the third year law. We really try to do the law before you go on into those advanced pharmacy practice experiences. Our last module, integrated module, as you see in there, is one called complex problems. This is that last 3 to 4 weeks of the curriculum before you go out into that last year of advanced pharmacy practice. And that is a class where it's really cool. You learn all that critical thinking, everything you've learned since the first year, and learning that you're going to apply it to complex cases, that there's no right or wrong answer. In fact, one of the things that we do is we break you up into groups, and each group is given a complex case, and they each present it coming up with a pharmacotherapy plan, a social determinants of health type plan, all of these things. And it's so cool to see 2 different groups come up with extremely different plans, but very solid in evidence and very good ideas to show that there's not only one way to actually treat some of these complex problems. And again, before you know it, those 3 years of sitting in the classroom are done, and you are ready to go out into your last year of the advanced pharmacy practice experiences. This last year is made up of going to a variety of different clinical settings. You're going to do 7 6-week blocks. 4 of these 6-week blocks are required. That is an advanced community, advanced institutional or advanced hospital, advanced or AmCare, and internal medicine. So, four distinct areas that are required, or four of those 6 week blocks, which leaves three 6 week blocks to have a plethora of different options to do for your electives. We have students that actually do an academic elective with us here at the college. You can go to MD Anderson and do hematology, oncology, critical care, infectious diseases. We have some that work with the CDC or go up to Alaska to the Indian Health Service. So many different options. You're in the middle of the world's largest medical center. So many different ways that you could really explore the variety of different options in the profession of pharmacy. Before you know it, the 4 years are over, as is this quick discussion, and you will be prepared to go out and do any area of pharmacy that you want to do postgraduate training or whatever it is that you are going to do in this amazing field of pharmacy. So, with that, I wish you luck on your interview today and have a wonderful week. Thank you.